Today we're exploring an important topic that offers hope and new possibilities for those with end-stage kidney disease. Life after dialysis. Exploring the kidney transplantations and other treatment options. In this episode, we're going to explore the benefits and challenges of kidney transplantation, alternative treatments, and how to make informed decisions to a healthier future. Welcome back to the Kidney Zone. I'm Dr. Mo. Before we begin, please remember that this video is for informational purpose only. If you have any questions about your kidney health or dialysis or transplantation, it's very important to consult with a healthcare provider. What is kidney transplantation? A kidney transplant is a surgical procedure to replace a healthy kidney from a living or a deceased donor into a person whose kidneys are no longer functional. It's often considered the best treatment for end-stage kidney disease because it can restore more normal kidney function. What are the benefits of kidney transplantation? Improved quality of life. Many patients experience better overall health and increased energy levels. There's also fewer dietary restrictions when you have a kidney transplant compared to dialysis. Patients often have fewer restrictions on what they can eat and can drink in terms of how much fluid as well. Also, longevity. Transplant can extend the lifespan of an individual better than in ESRD or end-stage kidney disease compared to long-term dialysis. So what are the challenges and risks? Surgery risk. As with any major surgery, there are risks including infections, bleeding, and complications from anesthesia. There is also with kidney transplant the risk of rejection. The body's immune system may reject the new kidney, requiring medication to prevent this. These medications are called immunosuppression. The long-term use of medications that inhibit the immune system can increase the risk of infections and cancers or other health issues. Let's talk about the transplantation process. Evaluation and listing medical evaluation is very important because comprehensive health assessment is important to ensure the patient is a good candidate for transplantation. How about listing? Eligible patients are placed on a transplant waiting list, which prioritizes based on medical need and waiting time. It's very important to talk about finding a donor. Living donor, which is a relative or a friend or even an altruistic stranger who donates one of their kidneys. There is another type which is deceased donor, which is a kidney from someone who has recently died and whose organs are donated. How about the surgery and recovery? Typically, the surgery lasts between 3 and 4 hours with a donor kidney placed in the lower abdomen, either the right or the left side, and the recovery time can vary. So the hospital stay is usually around 5 to 10 days with focus on monitoring the signs of rejection and infection. So how is the life after transplantation? Post-transplant care. The medications are lifelong immunosuppression medication to prevent rejection. This requires regular checkups or frequent medical appointments to monitor the kidney function and overall health. There are also some life adjustments that includes diet, for example, a balanced diet with possible adjustment based on the new kidney function. It's also very important to put in mind that exercise and gradual increase in physical activity is very important, aiming for a healthy, active lifestyle. Another factor to focus on is mental health. Support for emotional well-being, as adjusting to life post-transplant can be challenging for many patients. One of the positive aspects of kidney transplantation is longevity and quality of life. The success rates are very good. High success rates with many patients enjoying a normal lifespan and significantly improved quality of life. There's also some potential complications after kidney transplant, ongoing risk of rejection, infection, and complications of immunosuppressants such as infection and cancer. This all requires proper follow-up after transplantation to get proper medical care. So what are the alternative options for kidney transplant? Can be either continued dialysis, hemodialysis, and peritoneal dialysis for those who are not candidates for transplantations or prefer just to continue dialysis. These remain viable options with advancement in technology improving the quality of life. Also, there are some options such as home hemodialysis and peritoneal dialysis, which gives more flexibility because both can be done at home. There is also supportive or palliative care, focuses on relieving symptoms and improving quality of life without aggressive treatments such as transplant or dialysis. There are some holistic approaches, which includes integrating diet, exercise, and alternative therapies to support the overall well-being. Now let's talk about decision making and support. Making informed choices requires consultation with your healthcare providers. Detailed discussion with nephrologists, surgeons, and other specialists to understand the best options of transplant or dialysis is very important. There is some access to reliable information about all the available treatments, so accessing these educational resources can be provided by your healthcare provider. It's very important also to focus on the support system. Family and friends are crucial for emotional and practical support. There's also some support groups and foundations that connect you with others who have undergone transplantation or are on the wait list or waiting for a new kidney, or those who are on dialysis, and these all provide very good support and valuable insight and encouragement. So in conclusion, while dialysis is a life-saving treatment, kidney transplantation offers the potential for a more normal and active life compared to being on dialysis. Understanding the benefits, risks, and alternatives allow the individuals to make informed decisions about their health, whether considering kidney transplant or exploring other treatment options. It's important to have strong support system and access to expert medical advice. If you found this discussion helpful, please share it with others who might benefit. Stay informed, stay healthy, stay hydrated, and we'll see you in the next episode of The Kidney Zone.